Hi, I'm Bob Meyer. I'm a family doctor in Goldsboro, North Carolina, and I've been very distressed over the discussions and the politics going on in Washington about healthcare reform presently. The issue is of special interest groups and the business aspect of medicine, and they're fighting. Both sides are wrong. The general population has lost the idea that healthcare is a calling, it's a service. I have the credentials. I graduated from Temple University in Philadelphia with honors in medicine and pediatrics and OBGYN. Was elected Alpha Omega Alpha. Did my specialty training in family practice in Pittsburgh and was chief resident the last year. But the greatest credential that I have really is the 32 years that I've been in private practice in primary care, providing what is being termed now a patient-centered medical home, as if it was this new idea. The academics, which maybe you might consider me one because I do have clinical faculty appointments at 3 universities. The academics are talking about that as if it's a new wave, and we should look to that as being a way to provide health care. They're right. That it's not new. It's not new. Both sides are wrong. Both of the groups in Washington are wrong. The liberals and the conservatives are wrong about how to deal with this, mostly because they're continuing the same system where the special interests are involved and the business aspect of medicine is involved. You know, what it comes down to is a multiple paradox. John Q. Public, deep in his gut, feels that healthcare ought to be free. But he realizes that when it comes to him, for his health care, he wants you to spare no expense, and he wants you to be sure that the people that are providing health care for him are very well paid so that they can dedicate themselves to his care and not have to worry about other things, and so that they're the pick of the crop. When he has those two that are a paradox, he understands that probably the only way to do that is through government intervention. But he also is very fearful, and rightfully so, about healthcare being managed by politicians. And that produces a four-way paradox, for which the solution involves each corner coming in towards the center. First thing is that it can't be free. It has to be a universal entitlement. Everybody paying something. Those who can afford more probably paying more. Those that can afford nothing still having to come up with something. Maybe it's a voucher that they gain from sitting with a sick relative. I don't know. But provide something so that they have some skin in the game. And then, yes, you will have to pay people well to do the job. Those that have been called to do the job, those that look at the job as service, you need to pay them well. But you don't need to fund perverse profit. Now, perverse profit is a little bit hard to define, but I think you probably already know what I'm talking about. The Taj Mahal offices, the large CEO salaries for insurance companies and the like. You take those away, and we can afford health care for everyone, because it would be cheaper. Of course, you have the question of how do you do that, and it would have to be facilitated by laws passed and guidelines and assistance from the government. But then the politicians have to do something that they are really loath to do, and that's back away from it. To allow it to be managed at a regional or a local level by a group of concerned citizens, probably volunteers, and a board, civic organizations, charitable organizations, individuals with expertise. Yes, you'd have to have some medical professionals. You would have less than 50% of them. You'd have to have some pharmacists and some physicians on the board, but they'd be given some ideas and some tools by the federal government, but then the federal government would back away, and the only thing they would provide after that would be the tax basis to pay for it. How much would it cost? Well, I'm always amused by the concern that 17, 18% of the gross national product is spent on health care. What should it be? There's a lot of people who have jobs in healthcare. Matter of fact, right now, during our current recession, it seems to be the only segment of the economy that's providing jobs. You don't want to eliminate that. What you need to do is to decide what you're going to do to serve people, to provide care, without wasting money, without providing perverse profits to special interest groups, and then see what it comes in at and provide for that. Looking at the numbers and looking at the way there is such abuse and waste, not the kind that the politicians are talking about, but the real in your gut feeling that you get, it'll be less expensive than it currently is. I'm reminded that not too long ago, the insurance industry was complaining about how they had to pay the bill for all the uninsured because their beneficiaries paid more when the uninsured ended up in an emergency room and somebody had to absorb the cost. What that means is that they, and probably rightfully so, were already paying for that. So why is it going to cost so much more to cover the uninsured? The reason being is the insurance companies still want their piece of the pie from even those new ones. We've got to put a stop to that. We've got to put a stop to all of the special interests and return to the time when medical care was a calling and it was a service industry. That's just my opinion.